Can you see my screen?
Yes, madam.
Okay. So we'll try to do some questions, and you can also ask if you have any issues or doubts what you have. Let's start with some MCQs. Okay. So I need you guys to respond. What are the names? So first response. There are some people without names. Can you please insert your names? Okay, someone has raised hand. Who is that? Anyone can answer. If you don't answer, I will ask someone. Okay. Tepulini. What about A?
True, madam.
I can't hear you properly.
True. A is true.
Can stand with support. Okay. Right. Uh, B.
False.
That's right. So when what age does mature pincer grasp come?
12
12
months.
months.
Yes, good. C.
False.
False. Correct. So what age does a child say two words with meaning?
12 months.
Around 12. That's right. Okay. D. Sorry. What about D?
False.
Again, false. Yeah. So that again is around 12 months or 12 to 18 months. Yes. And E?
True.
E is true because they get object permanence around 9 to 12 months. So this is how you are going to get questions, right? This is a real question which we gave. Here's another one. Following are red flag signs in detecting abnormal development at 6 months of age. Rolling over.
False.
Correct. It's not a red flag, it can be normal. Persistent fisting.
False.
True.
Persistent fisting is true because why is that? Fisting happens usually when the palmar grasp reflex is there. So that should go around 3 months. At 6 months, it's definitely abnormal, right? So it's a red flag sign, and it's also an indicator of early sort of spasticity like cerebral palsy and all that. So it's abnormal sign. We are asking for red flag signs, which means asking for the abnormal signs in detecting abnormal development, right? C. So the answer is true for B, right? The persistent fisting is a red flag sign. What about C?
True.
True, yes. Because what age should the baby start smiling? Social smile comes at what age?
4 months.
No.
2 months.
6 weeks.
6 weeks. Yeah, now that you have to know, right? It's like head control. It's a very sort of a cardinal milestone. Okay. Absent babbling. So that C is true. D.
True.
Okay. So absent babbling. Now, what age do we expect them to babble? Babbling starts at which age? Are they supposed to be babbling at 6 months? Can someone try to remember what age? I hope you guys remember what babbling is. It's one of the early forms of speech. What age do they start the monosyllable babble? It doesn't specify whether it's monosyllable or bisyllable.
6 months.
At 6 months.
Around 6 months, yeah. But absence of babbling at 6 months cannot be taken as a red flag, because I mean it can be 6, it can be 7, it doesn't have to start on the dot. If it was supposed to start around 4 months and it's not still here, then yeah, okay, you can take it. But here you can't take it as a red flag sign, right? So if you remember, red flag signs are like, those are more than 2 SD away stuff, where they are definitely abnormal and you have to go and get an opinion from the doctor. So because babbling can start at 6 months, you are correct. But absence of babbling at 6 months is not a red flag sign. You may wait for some more time to see. You can see whether he's cooing and doing other stuff. If there's no cooing also, maybe. But if it's just at the time the milestone is starting, then you can't really say it's a red flag sign, because there's a variation between children. Okay, so absent babbling is false, right? Because they are supposed to start babbling at 6 months. Persistence of primitive reflexes.
True.
True. Okay. Right. So another MCQ, this time from breastfeeding, right? Following recommendations to establish breastfeeding are paired with the appropriate physiological explanation. What about A?
True.
Breastfeeding on demand soon after birth, yes. But reason why we need to do it is because prolactin secretion is stimulated by suckling. True, correct. What about B? Feed the baby at night when he or she wakes up, because prolactin secretion is increased in the night.
True.
True, correct. C. Build confidence in the mother. Why do we need to build confidence? Because oxytocin that controls the ejection of milk increases with feeling good.
True.
True, yes. D. Feeding twins simultaneously. Suckling at both breasts simultaneously stimulates more prolactin.
True.
True, correct. Good attachment. This allows the nipple to stimulate the posterior part of the hard palate to elicit the sucking reflex.
Yes.
No, that is also true. That is why we need good attachment. The whole of the areola should be inside the mouth, so that the nipple will stretch and actually touch at the end of the hard palate. When they do that, that is what stimulates a sucking reflex. So that is also true. So this is a question from the physiology part, right? So you need to know different things. Please go through all the things that we have done for you and read the extra learning material as well. So regarding, I just put one on growth assessment. Beam balance is more accurate than spring balance.
True.
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 Infantometer is used to measure the height of infants.
False. False.
Why is it false?
Length of the infants.
Length. Very good. Skin fold thickness is measured using the Haar pendant caliper. So these are, you have to
True.
remember the instruments,
True.
right? True,
True.
yes.
True.
Head circumference is measured using a non-stretchable tape.
True.
Yeah, because if it stretches, it's not going to be very accurate, right? So that's one of the requirements. The tape has to be non-stretchable. Mid-arm circumference is measured using a Shakir tape.
True.
True.
So that's a specific tape. Does anyone know what the Shakir tape is and what it's used for?
It is used to instantly identify thinness.
Yeah, it has 3 colors. No, it can be used in the field, so it doesn't need to have numbers. It's usually used for screening large numbers of people, like a nutritional survey or something like that. Okay, so I think that's enough for MCQs. So this I put a SCQ. Right. A 2-year-old boy is brought to the Well Baby Clinic for growth monitoring. He can walk with support but not without support. He is able to draw vertical lines but not circles. He can say 2 word sentences but is unable to give his full name. He is able to feed himself with a spoon and cup with minimal spillage. He is able to build a block tower with 9 to 10 blocks and is able to complete a 2-piece puzzle. He is the only child of a 45-year-old mother who looks after him and does not let him out of her sight. Determine the developmental ages for the 5 different domains in this child. Giving reasons. Okay, so let's start. Can someone name the 5 domains? What are the 5 domains?
Gross
Yeah.
motor,
Motor.
gross motor domain, fine motor, speech, cognitive, and social.
Very good. So you have got the 5 domains. Now for each domain, you have to get the developmental age and also you must write the reason why. So we actually give a table with this sort of thing. One column will say domain, one column will say developmental age, one column will say reason. Right? So 10 marks for each correct answer. If all 3 are correct for one, you get 10 marks. Like that, you will get 50. Right? So let's take one by one. If you take gross motor, what is the developmental age and why do you say so?
One year.
10.
1 year. He can walk with support but not without support. Okay. I heard somebody else tell 10 months. I think that is also correct because he cannot walk without support. So anything like 10 to 12 months will be okay, right? So it doesn't have to be a one particular age if you give a reasonable, but you can't say 1 to 2 years lage back yan. Months, if you are telling, should be a gap of 2 to 3 months is okay, this way, that way. You can't give big ones like say 6 to 12 months, you will be marked wrong. Or 12 to 18 months, but if you say 10 to 12 months or 10 months or 12 months, both are correct. You get full marks. Right. Let's move to the fine motor. So the reason you did not tell. What is the reason? So highest marks are given for writing the reason usually. You get maybe say 2 marks for writing the domain, say 3 to 4 marks for writing the 1 or 2 marks for the domain, maybe 3 marks for the age, and maybe 5 marks for the reason. How will we write the reason? Why do we say it is either 10 months or 12 months? Yes? Can someone answer?
Because he can work with support.
And you have to tell, yeah, you can have to say he can walk with support but cannot walk without support, or he can walk only with support. And this milestone occurs at the age of, or starts at the age of 10 months or 12 months or whatever you want to write. That is how you have to write. You have to say, because now to get the developmental age of a certain child, you have to get the margin or get the place where he can't do and can do. The last thing he can do, the most complex thing that he can do, and which will be next to the thing he can't do. So you have to identify that. You have to say, okay, walking with support occurs at 10 months and he is unable to walk without support. Therefore, the gross motor developmental age is 10 months. That is what is expected of you to write. Okay, moving on to the second domain. Let's go to fine motor. So can someone tell me the age as well as the reason?
Development age is 2 years
Okay,
because child of 2 years can draw vertical lines using the thumb and 2 fingers.
okay,
So this should be around 2 years.
correct.
Development age should be around 2 years.
You are correct, but one more thing you have to say. So vertical lines are drawn at 2 years and circles are drawn at
Circles
3 years.
3 years, so he can't do circles.
So therefore he is below 3 years and he is above 2 years. So you can see he's 2 years because he cannot draw the circles. You have to tell that part also. Okay. Good. Next one. Let's move to speech. He can say 2-word sentences but is unable to give his full name. So what is the developmental age and what is the reason?
His developmental age is 2 years because at 2 years, 2 to 3 words sentence are used with pronunciation of I, me, you, but the name given is developed at the 3 years. So his developmental age is at 12.
2 years. Right.
2 years.
So good. That is how you must write. Then let's move to the next one, social and adaptive. He is able to feed himself with a spoon and cup with minimal spillage. What about the age and the reason for this? Social development. Yes. So when can they feed themselves by spoon? When can they feed themselves by cup? And with minimal spillage.
Three years.
Maybe 2.5, 2.5. Is it 3 really? Because it's minimal spillage.
Madam, at around 18 months, they can start drinking from the cup alone.
Yeah, that's true. What about the spoon comes a little later, no?
Yes.
Spoon must be around 2-ish. So this minimal spillage business, this must be, I think, I also can't remember exactly, 2.5. Check in the book, it's there in the book, the Mary Sheridan one. Must be like 2.5 or something like that. So anyway, it's either 2 or more. Okay, then the next one, cognitive milestone. He can complete a 2-piece puzzle and block tower of 9 to 10 blocks. When can a child, you'll have to remember, you have to know the block tower ages as well as 2-piece puzzle is like the sentence. 2-piece puzzle is around generally 2 years. The more pieces, the more complex increases with age. Right. So can someone remember the block tower?
3 years.
Yeah, this is about 3 years, and two-piece puzzle is about 2 years. So it's somewhere between 2 to 3 years. Right. So then we have now completed all 5 domains. We have written the domain, the developmental age, and the reason. Right. So for writing all that, you get 50 marks because it's quite a bit. You need to write the 5 domains, 5 developmental ages, and 5 reasons. The next is describe the overall development of the child, giving reasons. So now we have identified the developmental ages for the different domains. What do you think? Looking at the whole picture now.
Calculate the developmental quotient.
You can if you want to. I think it has 10 marks, no?
This is a specific developmental delay.
Hmm?
This is
Sorry,
a specific developmental delay.
yeah, correct. Of which domain? A specific code you have to take.
Yeah, gross motor development
Yeah.
is
So
impaired. Development quotient is around 50%.
correct, good. So actually developmental quotient will help you to see whether there's a significant delay or not. Sometimes it can be like a gray area like that absent babbling, you all got a bit confused with the MCQ. Right? So it can help you, but you don't have to do it. So what you need to say is now, let's say gross motor development, as your colleague mentioned, is 9 to 10 months, and it's about 50% development quotient. Whereas everything else we looked at are around 2 years or more. Right? So he's either okay or advanced for the rest of it. So therefore, those domains are not delayed at all. And it is only the gross motor delay that is, only the gross motor domain that is delayed. So only 1 out of 5 are delayed, in which case we call it a specific developmental delay. And as your colleague mentioned, it's significant because it comes to about 50% or less when you check it. So therefore, you can say it's a specific developmental delay involving the gross motor domain, right? So I hope you remember to say global developmental delay. It doesn't have to be all, just more than one, that is 2 or more. If it is delayed, we can call it a global development delay. So anyway, for this one, the answer is a specific developmental delay involving the gross motor domain. So if you write that, you get the full 10 marks. List 2 possible reasons for his present state of development. Just want you to go through the principles of this. So try to think of a condition where they have a specific developmental delay, right? And not really a global developmental delay. We don't expect hi-fi disease names because we know you have not done neurology. Just the principle is enough. Would someone like to attempt? Yeah, what do you think?
Here says the mother looks after him and does not let him out of her sight. So due to that, she might also always, as he is her only child, she must not let her down from her sight. That means she was always carrying him or keeping her in lap or letting him
Yeah.
sit down and play, but not walk around and do all the things with his own things and not experiment new things like sitting up and doing things with physical exposure.
Yeah, you're
So
right. So that
it's
may be lack of
mostly
opportunity because of the overprotective nature of the mother. Yeah. So that can lead to it. You're absolutely correct. And see, it's a elder. Oops, what did I do? It's a sort of a elderly mother, also 45 years old. So she's got the child after a while. So she must be very anxious. We do come across moms like, but the problem is if you don't, like your colleague mentioned, if you don't let the child down and you don't allow the child to experiment, they don't learn many things and they can fall behind. Right? So you're absolutely correct. That was one answer. What is the other one?
Problem with the muscle tone.
Yes, if you said that, I would have been happy. I don't need the names, just it's a muscle problem, or you can say it's a neuromuscular disease or muscular disease, because the rest of him is okay. So it doesn't look like it's something with the brain, right? So you people have done stuff for in basic anatomy, so this is not something that's really harming the brain. If it's harming the brain, it's only the motor area that is gone, right? So yeah, you can take it as a muscle disease. Correct. Any other answers? There can be more than one correct answer. Anybody else has any other answers you want to tell? Yes, no? Okay, outline the principles of management for this child. What are the principles of management? The principles, right? So it's 30 marks. You'll have to write some. Oops, what did I do to my presentation? What are the principles? Yeah. This would have been covered during your PBL. What are the principles you are going to write?
Treating if there's an underlying cause, like
It's very non-specific. What cause? Now think of the answers you all gave. Right? Now that question has to be, you gave certain reasons why you think why you think this is happening to this child. So in keeping with that, how will you address this problem? If you find a child with gross motor delay, what will you do? In other words, that is what we are asking you. We are not asking how to cure it. We are asking how will you manage. Let's say you are like a GP or you are a first contact doctor. What do you have to do? This patient comes to you when you are a GP. It's not detailed neurological things are not expected, right? So what do you think?
Refer to a suitable specialist.
Sorry?
Refer to a suitable specialist.
Suitable specialist කියලා කවුද තීරණය කරන්නේ suitable ද නැද්ද කියලා? You are the doctor. You have to decide which specialist you want to send to.
Neurologist to a pediatrician.
Definitely not a neurologist. It has to be a pediatrician. Right? I mean, all these children with issues, you have to first send it to a general pediatrician. If it's a neonate, to a neonatologist. If it's a child, to a pediatrician, not to subspecialists first. Right. So then the pediatrician will decide if it needs to go to a neurologist, because you shouldn't send it to adult neurologist at all. Pediatric neurologist is a different matter, but you should send it to a pediatrician, because pediatrician is the one who has to look after the overall care. If they go to the neurologist, only the neurological part will be looked after most of the time. That is not good enough, because baby's growth, vaccination, so many other things have to be looked after. Right? Pediatrician is one answer is yes. If you are seeing this child in your general practice or whatever, you have to refer this child to the pediatrician. What else? That is one answer expected.
Reassuring the mother to provide stimulation for the child.
I can't hear. Can you speak a little louder?
Reassuring the mother in order to provide stimulation for the child.
But ඒත් හරියට ඇහෙන්නේ provide stimulation for the child නේද ඔයා කියන්නේ. Correct. So what stimulation? You have to tell a little bit more. You are getting 30 marks for that. නේද? තව පොඩ්ඩක් ඒක විස්තර කරන්න. What sort of stimulation? Can't hear you. Now can't hear anything now. Can someone else take up from what he said? He's correct. You have to stimulate the child. How do we do that? Can someone elaborate on that? Yes?
Get advice from a physiotherapist.
Okay. Physiotherapy for what? You must specify. Why do we refer? We should be actually referring to the pediatrician. Pediatrician should be referring to the physiotherapist. But yes, physiotherapist has a place here. So for what part will the physiotherapist do in this patient?
Providing the mother with knowledge about the exercises the child could do to strengthen muscles.
Yeah, so there we don't know. Okay. Now, did none of you all mention? Now, do we know whether there's a neurological problem or not? It can be that she is not allowing this child to be on the ground. If so, neurologically and examination-wise, baby will be normal. You will not find any abnormality. So you have to first examine the child, no? You should take a history, right? See whether there is any problem, birth history, right? Any family history, all that. Better to take, if this is a patient who came to you, better to take a history, and you should do a neurological examination to see if it is a neurological problem or a muscular problem. Then you will have some findings directed to it. Now, although you haven't done the module, you should know the difference between upper motor neuron and lower motor neuron lesion from anatomy. Am I right? You all learned that, no? Yes or no? Forgotten?
Yes, madam, we have learned.
Yes, I know you have learned, because I have also been through the same curriculum. So, therefore, we should do a neurological examination, right? That might give us some clues as to whether there's a neurological problem or not. So you should actually start your answer by saying you should take a history and examine the child for neurological deficit. That is enough. You don't have to go into a lot of detail. And then after that, you should say if there is no neurological deficit, and then it may be most probably due to this protective nature of the mother, and you can advise her actually. No need of a physiotherapist. You can advise her to sort of counsel her about the importance of giving opportunities for the child to experience new things. And if there are issues, we can also in the meantime refer this child to a pediatrician and can get the help of a physiotherapist as well. So as a GP, if you come across a child like this, you should refer this child to a pediatrician, right? Who in turn should do the rest. But you can also we should not only refer to a physiotherapist because the child needs overall care. Right. So one answer is, I think history examination should be one. Then referring to a pediatrician would be another one. Stimulating the child, allowing the child to experience play, giving more independence to the child. I mean, that also is important even if the child is having a neurological problem. And yes, doing physiotherapy, all that is also important. Any other answers anyone wants to add?
Following up the child after.
Sorry?
Follow up the child.
Yeah, I think this child anyway will have to have a follow-up, no? We can't just see him or her once and send off, no? So child will have to be followed up by the pediatrician with regard to, improvement of the gross motor function. So yes, there will have to be follow-up, but that won't be a separate answer. You can add it to one of the others. Any other answers anybody else wants to add? Okay. So do you have any questions with regard to any of the things we did? Any doubts to be resolved?
Madam, when we are taking something as a delay to be concluded as a specific or a global delay, if we consider it with the quotient, should it be less than 85 to be considered as a delay, or more severe? Should it be severe?
Well, if you say it's a significant delay, it's a severe one, a moderate to severe one, no? If I remember right. But if it is a mild delay, you can mention it as a mild delay.
Then, madam, if you are counting the aspects of development which are not up to the mark, then
Yeah.
should we take something which has a quotient of around 75 as a should we count it as one?
As one meaning what?
I mean, one which has a delay.
Anyway, you should say there's, significant delay කියන එකට අපි definition එකක් දුන්නනේ නේද? More than 2 SD කියලා.
Yes, ma'am.
Yeah, so you can use that. More than 2 SD කියන එක තමයි significant delay කියලා කියන්නේ. ඒ වුණාට mild delay එකක් ගැන කතා කරන්න පුළුවන්. ඒවාට ගෝවාගෙන් අහන ප්‍රශ්න අනුව වෙනස් වෙනවා. Now in the clinic or when we see a child and he's having a delay, even if it's a mild delay, we should start stimulation, we should examine, we should look at the neurological thing. We don't have to wait until the significant delay comes. Even let's say මාස 6න් අනිත් ප්‍රශ්නේ වගේ අපි ඇහුවේ red flag signs කියලානේ. red flag sign එකක් නෙමෙයි. red flag කියන්නේ හොඳටම urgent කියන එක. but මාස 6න් babble කරන්නේ නැත්තම් බබා, we should see why. Maybe the parents are not talking, maybe the child is in front of a TV. Something is going on. So we have to intervene as early as possible. Right? So for that, any delay is important to intervene. Even a person without a delay, we can tell things to, optimize or stimulate the development. But any delay, like let's say මාසෙන් අපි බලනකොට බබා චුට්ටක්වත් ඔළුව උස්සන්නේ නැහැ. මූණ දිහා බලන්නෙත් නැහැ. So fixing following with nahi. So yes, I mean, although yes, it can take some more time. The head control milestone is like around 3 to 4 months. But at 1 month, if he's not doing anything and the tone is high and he's not looking good, we have to start intervention. So to start intervention, any delay or any abnormal finding, any abnormal neurological finding, you have to act on it. But if you are being asked a specific question about a significant delay, you have to take the 2SD. Or if you ask for red flag sign scale again, it's a 2SD one. Depending on the question that is asked. But in real life, any sort of delay, you have to act on it.
Okay, thank you.
Okay. Any other questions? If there are no other questions, maybe we should end because you are having another, Dr. Anil is doing a session at 10. Any other questions? Okay, so if there are no other questions, we will end this session.
Thank you,
Uh,
madam.
Okay, so thank you for everyone who participated. Oh, is there a question? Reassuring the mother. Okay, I think that's part of the question we did. Okay, so thank you everyone. All the best. Bye.
Thank you, madam.
Okay.